Dr. Guarini, sometimes babies are born and they get back from a newborn screening, something wrong with blood, and they think they have some kind of a thing called a hemoglobin trait of something. What is that all about?
Well, actually we live in a multicultural society. This is a country of immigrants, and with their culture they bring their genes. And there is a condition which is actually fairly common around the world, which is called thalassemia. This is a genetic condition. It's an abnormality in the protein and the gene that makes hemoglobin the main carrying molecule for oxygen in the blood. Now, we have to make an immediate and important distinction when we talk about genetic disorders. A lot of people, when you say genetic disorders, think that they have a dreadful disease. Most of us carry what are called traits, meaning that only half of our genetic thalassemia can be detected in the fetus after conception, and that would then give an opportunity to the parents, if they so choose, to make decision whether or not that pregnancy would be carried to the end or not. But for the child who has thalassemia trait, the main issue as a child is to know that that child does not have iron deficiency, because, as I said, that's the common way, the common confusion that occurs. And once they know that they have thalassemia trait, they also can know later on that if their partner has this condition, then they would have to have some concern about their progeny. This should not be a big concern, but one of the things that I tell to all the mothers who come to me when this comes about is that their 1 or 2 year old child who today we know has perhaps thalassemia trait, 10 years down the line or 20 years down the line, when their time comes to marry, God only knows how many other conditions will exist that we will know about from a genetic standpoint. So this is perhaps just one of them, and that generally eases the concern.
How is thalassemia treated today?
Well, as I said, thalassemia trait per se does not require treatment.
I'm talking about the actual disease.
If patients have thalassemia minor, and here I have to digress for a second, because when we talk about thalassemia, we really have to be precise. There are two of them that are generally we talk about. One is the so-called beta thalassemia, which also known as Mediterranean anemia, because it affects people from all over the Mediterranean basin, i.e. North Africa, Italy, Greece, the Middle East. But that genotype also extends into population further east, meaning Pakistan, Bangladesh, India, and with some variation into Indochina, what was used to be Indochina, I guess. So that's thalassemia beta, and that's actually when two individuals who are traits marry and have children. Each pregnancy has a 25% risk of having a child with thalassemia major. That's actually a serious illness, and it's an illness that gone untreated, as in the old time, essentially made this individual die within the first 10 years of life. Nowadays, we treat them with transfusion, and with transfusion, their life expectancy has grown substantially. The problem that occurs with transfusion is the fact that with the blood, we also give excess iron, and that iron over time builds up in the body, and it becomes a significant poisons the endocrine system, the liver, and more importantly, the heart.
Is there a way of getting that iron out of the body? Yes.
As a matter of fact, for a long time, we only had one drug, which was called Destro, needed to be given under the skin essentially every day in order to prevent this problem. Just recently, a second drug that is an oral drugs that gets rid of the iron in the body has just been approved here in the United States. and most, if not all, of our transfusion patients are now on it, and at least the initial impression that we have has been out for about a year in an approved fashion, is that it's very effective, and patients seem to tolerate and take it very well.
What do you expect the life expectancy with that kind of a diagnosis?
Hard to say, but most with Desferal, patients with thalassemia have lived into their 30s, their 40s, and beyond, if well chelated. It is our expectation that with XJADE, actually, that will go even further. The other thing that should be noted about thalassemia is that thalassemia is not only treatable, but it's potentially curable, because bone marrow transplant has been proven and is an established way to essentially cure people with thalassemia.
What percentage of kids with thalassemia, the true disease, end up with bone marrow transplants?
Well, until recently, the vast majority of patients who could be transplanted were patients who actually had a sibling, that is, a brother or a sister, who was a perfect match or an acceptable match for bone marrow transplant. The people expert in transplantation were not in favor of using what's called unrelated donors, that is, donors that were obtained from the general population through a registry, because of the risk benefits. Transplantation, though, has improved over the last 2 decades, and recently there is at least the thought that unrelated donor could be used for patients with thalassemia, which would open up the possibility of more patients with thalassemia being transplanted. It's a little hard to tell you what exactly the statistics are, because it depends on the size of the family. Each time there is a sibling, there is a chance in 4 that that sibling is a full match for that particular patient. So it depends on the size of the family.
So it's a disease that can be managed?
It is a disease essentially that can be managed, and it's a disease that has a potential for cure. In addition, there is all kinds of studies that have been going on for a while that are even thinking about the possibility of so-called gene therapy, where essentially a new gene would be given to the patient who has this genetic problem, in the hope that that would treat it. I mean, I think that's still in the infancy, and I think we have a way to go in that area. But a patient with thalassemia who's well transfused and well chelated has at this point in our mind, a life expectancy that is very good and has the potential for cure through a bone marrow transplant if the circumstances are right.
Thank you, Dr. Guarini.